Sciatica is something that a lot of people experience, but a lot of times people come in and they think it's sciatica, but it's actually not. Now, why do we have so much sciatica in the world? Well, it's because we've gotten to a society where most of us either sit down, and when you sit down at work, so you're sitting down, the pelvis is rotated, and that actually pushes the disc into the nerve. And so when you try to stand up, it can actually irritate it because then it starts going this way, the disc is pushing into the nerve, and that causes those symptoms. Also, people that bend down and do a lot of manual labor, they're bending down. When they bend down, it's pushing the disc backwards. They're lifting heavy objects, which puts a lot of pressure on that low back as well, which leads to more pressure on the nerve and causes the symptoms. Now, in the low back, we have 24 bones in the spine itself. The last 5 are the lumbar vertebra, and then you have the sacrum right down here. And the ulnar nerve is made up of the last 2 lumbar nerves, and then the first 3, the top 3 sacral nerves, and it goes down, let me go this side, it goes down through here, and it's about as big around as your thumb, a lot bigger than people realize. So it goes down. We also have external hip rotators that are right around this area. And so what can happen is if you have tightness in those muscles because you're not stretching like you should, which I'll show you in a second, it can put pressure on the sciatic nerve, and that makes symptoms, burning, numbness, fire, whatever you want to call it, go down the back of the leg. Sometimes it goes to the hamstring halfway down, sometimes it goes to the knee, sometimes all the way down to the foot. And usually that's indicative, if it goes all the way to the foot, that you have more pressure on that nerve than if it just goes to halfway down your hamstring or just stays up here in your butt cheek, for lack of a better word. So other people come in and they have pain down the outside of their leg instead of in the back. That is actually pressure on the lateral femoral cutaneous nerve, for another big word, and is not sciatica. And a lot of times they have tightness in their IT band, which is on the outside of the nerve. And just so you know, that is one of the longest ligaments in the body. From that tiny little muscle at the top goes all the way down the side of the leg. So what do we do? What are some stretches, things like that? So with the adjustments, you have the spine like this, and a lot of times you have pain in the sacroiliac joint right here, which is where the sacrum and the sacrum and iliac crest of the pelvis articulate. If that gets inflamed, you can see that those nerves are right there, so that can cause issues in the sciatic nerve. But what we do is we have the patient lay on their side, contact right here on that joint, and do an adjustment to help realign the pelvis, and that can take pressure off the nerves. Sometimes there's pressure on the nerves up in the lower lumbar spine, like I said. Do adjustments there, realign the vertebra, that takes pressure off the nerves, because when the 2 vertebrae come together, it forms a hole where the nerves come out, and if it's not lined up the way it's supposed to be, it's going to put pressure on those nerves. If we realign the spine, that takes pressure off the nerves, and that helps get rid of your symptoms. So stretches we can do for that. First one is the piriformis stretch, or the external hip rotator muscles. So I'm going to scoot back here. Hopefully you can see. Bring your right knee up to the opposite shoulder. Pull it with your right hand, and then pull up with your left hand. Now, when you push over with the knee, you'll feel it in the upper part of that external hip rotator, and then when you pull up on the knee, you'll feel it in a totally different area. So you're going to pull that up, hold it for 5 seconds, and then relax. You're going to do that 10 times, and you can do it 3 times a day, both sides obviously, and that's going to help stretch out that external hip rotator, which can take some of the pressure off the nerves. Another way of doing that, if you can see, is you cross your leg over. This is my right leg over my left. My ankle is resting on my left knee, and then we roll around this way, keeping good posture. You just lean forward like that. And when you lean forward, that takes some of that pressure off the low back because it stretches that external hip rotator. and takes pressure off those nerves, which can help a lot. Sometimes you can just do a hamstring stretch. We recommend that as well. Laying on your back, pulling your knee up towards you, and that can stretch the hamstring, or you can even have your leg straight and pull that to help stretch out that hamstring. So these muscles, when they're tight, can put pressure on that sciatic nerve, and that is something that you don't want. So if you want to avoid the symptoms of sciatica, do those stretches, consult a chiropractor in your area. If you're in the Boise area, come by and see us at Keystone Physical Medicine. Chiropractors in general, pretty much all of them, are trained to know how to deal with sciatica. I've had patients come in that had such severe sciatica they literally had to get wheeled in on an office chair or even in a wheelchair, but usually in an office chair because not everybody has a wheelchair laying around. And it is something that we can help so much just after a couple of adjustments, because if you have just a little bit of pressure on that nerve, it can cause major symptoms, but just getting that pressure off a tiny bit can bring a major way in how you feel, major change in how you feel. And multiple adjustments are actually going to realign the vertebra to take the pressure off as much as possible, correct that underlying structural damage that's allowed that to happen in the first place, and that helps to prevent those symptoms coming back in the future. All right, next we're going to talk about TMJ, temporomandibular joint, and what chiropractors can do for that. All right.